Hey, what's up guys? Doc Raj back with the Human Performance Project from Move Athletics. I want to talk to you today a little bit about some ankle mechanics and something that you need to be having that's not dorsiflexion in order to have a good squat. So we need to drive our knee out to the side when we squat, right? So for here, we need to be able to keep our foot, our heel flat, and bring our knee forward, right? And drive the knee out to the side and keep that foot flat there. And you'll commonly hear people call this a lateral tibial glide, and they'll hold down here and they'll try to bring their foot out. Well, I just got to tell you guys, there's no such thing as a lateral tibial glide. That's a really roundabout way of getting a lateral calcaneal glide. So if you take a look at this, let me put this down here, right? This guy needs to be able to tilt in and out. And that is what's going on. So if you can't get your foot, your heel to stay down and have your calcaneus evert to allow that to happen, then you're not going to be able to drive your knees out, right, in your squat. So instead of trying to come here and hold this and drive it out, let's look at how we can be more specific to that joint. So I'm going to use my treatment table here. You can use a box. You just want something to pad the edge of it. And you get these little bumps, right, in your ankle, specifically this lateral one or the outside one. You're going to want to put that right on the edge of the box there. And that's going to be a little uncomfortable, so you're going to want something to pad it. I'm just going to use a rolled up towel here. All right, so I just roll it up a little bit, enough to provide a little bit of padding, and I put my ankle bone, that little bump, my lateral malleolus, right on the edge there, so my heel itself is hanging off. Then all I'm going to do is get in this pigeon pose type position, keep my elbow straight, my hand is covering my heel here. You can see it's just right over the heel. And then all I'm going to do is get my shoulder over my hand and then just lean on my hand and push straight down towards the ground. And you can let your heel roll out, because that's what we need it to do anyway, so you can actually push it out and then push straight down and hang out there. You can try to push a little bit more on your thumb side of your hand, a little bit more on your pinky side of your hand, see where you feel more of a stretch, but you just want to keep that force down towards the ground. Don't bend your elbow and try to push, because that's too much work for no reason. Keep that elbow straight, lean over top, and then just lean on your hand and put your body weight down there. Or if you can get a super friend to help you out, that'll be much better too. So then you can retest, can you put your foot down, get into a little of dorsiflexion, and then drive your knee out a little bit better. And the answer to that is most likely going to be yes. It's definitely going to be yes if that's what's restricting you. So stop trying to do a lateral tibial glide, because it doesn't exist, and start doing a lateral calcaneal glide, because that's what's limiting you. Make sure that you use it actively. All right, so after you stretch, squat, drive the knees out. Let your brain recognize that new range. So guys, like this video, comment, let us know how it goes, tag somebody who needs to see it, and we'll see you next time on the Human Performance Project.